going to be going over now is the maintenance of an airway in a patient who is unconscious. There's one thing that you can remember from this is that unconscious casualties are unable to maintain their own airway. The reason for this is when a person is unconscious, that means their level of consciousness is below the level of sleeping. When they're in this lower level, their faculties to maintain the airway is gone. Something that you can do for an unconscious casualty would be this. What I'll be demonstrating now is the head tilt chin lift. If you look at this patient, they're in a position where there is a vulnerability from the tongue falling backwards and blocking the airway. When you do a head tilt chin lift on an unconscious patient, it pulls that entire region of tissue so far from the back of the throat that it is unable to block the airway. I'm going to lift the chin and tilt the head backwards. This is also known as the head tilt chin lift maneuver. Notice I grab the bottom of the chin, lightly press down on the head, pull it backwards.